So there are now two vaccine options for children 6 months and older. The first is the Pfizer vaccine. The Pfizer vaccine is authorized for children 6 months through 4 years of age. And recall, there already was an authorization for children 5 and up. The version of this vaccine for our youngest children is a 3-dose series. That's different than the 2-dose series that older children and adults have been receiving. It's a much smaller dose, 3 micrograms per dose. And the schedule is after the first dose, there needs to be at least 3 weeks between the first and second dose, and then at least 8 weeks between the second and third doses. So it does take slightly longer to complete the Pfizer vaccine series for children in this age group compared to older children and adults. Now, the other version of the vaccine that's now available is the Moderna vaccine. The Moderna vaccine is a 2-dose series, similar to how it was being used in adults. And for children 6 months of age through 5 years of age, it's a smaller dose of 25 micrograms. The 2 doses have to be given at least 28 days apart. And that is similar to the schedule that adults who received the Moderna vaccine were on as well. So for this age group, we now have 2 terrific options. I'm often asked if there's any difference between the 2 vaccines. In other words, would I recommend one versus the other? And really, in my mind, they're both terrific options. And I don't have a strong preference for one versus the other. Some families may want to have the vaccine series completed a little bit earlier and might opt for Moderna, whereas others may choose Pfizer because that's maybe what they're more comfortable with based on if that's what they've received, et cetera. Many primary care clinics in this age group are picking one vaccine versus the other just to reduce the possibility for administration errors, et cetera. And whichever vaccine is being provided at your provider's office, I think that's the right answer. So I think that either vaccine is a terrific option.